Hello, everyone. I'm Ellie from Nourishment Redacted, and welcome to Lioness Lifestyle Live. This is a show where we honor a keto, carnivore, or meat-based woman. They share their experience and their healing journey to inspire and bring our community together.
And I am Cristie from Meeting Wellness, and it is so nice to meet with all of you this evening. We've all been inspired by someone's story, and so we believe that sharing stories is one of the best ways to help people who are sick and without hope.
And I'm Adrian from Adrian K. Gledhill. Welcome to our show today. If you have any questions for our guests, please put QQQ or question in front. We'll be sure to get it to her.
Absolutely. And now it's time for something that we like to call the Roar of the Week. So this week's Roar of the Week says, just found this channel through the Plant Free podcast. Shout out to Dr. Chafee. That was so fun last week. And I'm so inspired. Your content has given me a whole new level of confidence in embracing the carnivore lifestyle. It's so encouraging to see the success stories and valuable insights you share. I'm officially a big fan now and can't wait to keep learning and growing. Thank you for all the amazing work you do. Thank you so much. And we love to shout out comments like these. So if you would like to be next week's Roar of the Week, leave us a comment after this live stream is over down below, and we will hunt through those and find someone to shout out for next week's show.
I love that comment so much. That just made I think all of our hearts soar. So thank you so much for writing that. And so tonight's guest is Dr. Jodi Nishida. She's a doctor of pharmacy and an accredited metabolic healthcare practitioner, who specializes in ketogenic nutrition. She has been inspiring and healing many with metabolic disorders through nutrition. As a carnivore, she has used her own healing journey to help others through her practice. No longer working for Big Pharma, she's making a big difference for her patients in Hawaii. Let's give a big welcome to Dr. Jodi Nishida.
Hi, ladies.
Hi, welcome.
Hello.
Thanks so much for being on our show. We'd love to get to know you. Can you tell us about yourself and why you choose to have a ketogenic approach to your practice?
Very long story short, I stumbled upon keto 8 years ago after one of my family members had a heart attack. And one of my colleagues, who is a pediatric neurologist here in Hawaii, works at a medical center where they actually use keto in their epilepsy and their autistic patients that are all children. And so he knows, the extensions of the diet. This was 8 years ago. And he said, you should put your family member on keto. And I said, what's a keto? So he goes, why don't you look it up? And as I did, I was telling Sean Baker, I think I spent 300 hours of just independent research and reading and watching videos. And at the end of all of that, it was like, duh, this makes total sense. What are we doing? Oh my God, I think we're practicing medicine backwards. And so I kind of figured out how to do keto. Back then it was really hard. There weren't a lot of keto doctors. And through helping my family member, what happened in the process was my own very, very severe autoimmune condition went into remission. And so that was like the nice piece of the puzzle for me to realize that I think this can help a lot of people. And I need to figure out how to do this legally in Hawaii. And so that started the whole journey for me.
Wow, that's amazing. So are you eating a ketogenic or carnivore diet yourself? And if so, how long have you been doing that?
Okay, so I can safely say I've been keto for 8 years. I call it clean keto. I'm pretty sure I'm the one that coined that term because I was sick and tired of dealing with all the misunderstanding around social media / dirty keto. But over the years, I transitioned into more of what I call a ketovore diet. Definitely strictly carnivore days. What I tell my patients is that I probably consume no more than 1 cup of vegetables in an entire week. And that's purely for color, variety, and texture, so that mentally I don't get bored with it. Does that make sense? Yeah.
So, what kind of training did you have on nutrition in your pharmacy school? We have a couple questions here. I think that's the gist of the question, which this person has two family members that are pharmacists, and neither of them know anything about cholesterol, except maybe to take medicine. And then, so the schooling doesn't sound like it's much different, that there's just not much nutrition.
No, okay, so what people don't realize is, so I'm a doctor of pharmacy, and in pharmacy school, the first couple years of our training and education is almost exactly like MDs. But in the last 2 years, we kind of veer off and we focus very heavily on all the different medications, all the different pathways in the body that medications work on. I can confidently say we know more about medications than MDs by light years. It continuously confuses me as to why MDs are the only ones with prescribing authority when they get the least amount of education in medications. But, that's a whole separate conversation. We got zero nutrition in school. I think MDs maybe get a class, not even a full semester for most of them. So everything that I learned 20 years after I graduated pharmacy school and was already working as a pharmacist. And you guys heard in Sean's podcast, I did work for Big Pharma for over 10 years in different capacities. And so where I get frustrated, and I like to speak pretty frankly, because I think there's enough information out about this now that we don't need to beat around the bush, right? Doctors will prescribe medications very honestly because they're not getting kickbacks necessarily, unless they actually speak for the drug company. So that's not what's driving them. It is my belief that they do it because it takes the least amount of time and effort. For someone to look at your lab values and write a prescription, that takes almost no brain effort because it just becomes routine. To sit down and talk to someone for 30 minutes at every appointment, which is how my clinic is structured, and give them handouts and teach them what to eat and all of these things, that takes time and effort. And I think a lot of them just don't want to spend that time. You don't make $1 million a year by spending 30 minutes with each patient. I'm going to tell you that up front. So all of us, because there are a lot of keto doctors around the nation, I'm in touch with all of them. The ones that are accredited, like myself, and that's important because for us to legitimize this as a medical approach, we can't be willy-nilly about it. Do you know what I mean? So we all get accredited through the Society of Metabolic Health Practitioners. And if you ladies are not familiar with them, familiarize yourself, because we have guidelines. We have our own medical journal. We do our own clinical trials. And we have our own continuing education and accreditation process. And so whether you're an MD or a nurse practitioner or a pharmacist or whoever, you can go through this and get that accreditation.
So your patients, are they coming to you from being recommended by other doctors, or they're coming to you through social media? What is the process of how people find you? Because you obviously have a great Instagram page and YouTube channel as well. So.
Thank you for that. I actually don't have a good YouTube channel because I just don't have time to put anything on it. Yeah, I'm going to say that 60% of my patients come from word of mouth referrals, just friends and family saying, oh my God, you have to see my doctor, Dr. Jodi. She saved my life. I'm off all my meds. And Hawaii is a unique place. I tell people my goal is not to be world famous. I really want to spend most of my time helping the people of Hawaii first and foremost. 20% come off of social media directly. They'll just, people will share my posts, especially if I post about diabetes, cancer, perimenopause, all these things. Those are the posts that get shared the most. And then the other 20% is physician referrals. But I'm going to tell you, there's only 5 doctors in Hawaii that refer to me, because 99% of them are still adamantly against this lifestyle. It's a struggle.
Yeah, well, I was going to ask. So first of all, I just want to like to make a comment. So when you said that about the prescription medication and how it's just so much quicker to just take some labs and then write, I think some of that has kind of bled over into society as well. I think when people go to their doctor, they're looking for medicine.
Yes.
Because there was, I was just thinking of this lady at my work. I'm a teacher, and yeah, she was like, I went to the doctor because XYZ, and they didn't even give me any medicine, and she was mad. You know, I don't know what they did do, but I'll never forget how upset she was that she left that doctor's office with no prescription. So I think now that attitude and that idea has kind of bled over into society, and they think that if they didn't get their
Just look at
prescription,
Ozempic. Isn't Ozempic
right,
the perfect example of that? Yeah.
Yeah,
You're right.
absolutely. Yeah.
So it's not just the doctors, right? The society is complicit in this mindset as well. Totally. To find individuals like ourselves, us 4 women here, that actually want to make a lifestyle change and do the learning and do the work, I'm going to say that's 1% of the population. And see, the pharmaceutical companies know this, so they're going to capitalize it and make as much money as they can off of it. They're not stupid, you know?
Yeah.
Mm-hmm.
So when you see patients, my question is, what kind of, I don't know, like diseases or what kind of conditions, I guess, are you seeing, and what kind of results are you getting?
Yeah. Okay. I see everything from head to toe. You know, when I first opened my clinic over 5 years ago, and I actually did it with the help of our Blue Cross Blue Shield plan out here. So I'm one of the only dummies, I guess you could say, that accepts insurance to see me, because I just learned this in August at our conference. Everyone else is just charging cash, you know, but I can't help Medicare and Medicaid patients if I'm charging an arm and a leg to see me. Do you know what I'm saying? So I thought I was just going to be teaching people how to eat. And I didn't realize that I was going to be coming across, I'm not kidding, every medical condition from head to toe in every age group has walked into my office. Why? Because outside of the small percentage of genetic trait that affects people, you guys know that the majority of it is environmental. It's what they're eating. It's lack of sleep. It's their stress level. It's so many things. It's seed oils. It's lack of exercise. It's all of these things, right? And so I've seen over 3,000 patients now in 5 years. And the results that we get in our office, and my partner is a cardiologist. Now, she doesn't do keto with her patients. It's through her that I'm able to do this practice legally in the state of Hawaii, according to our laws. But she does keto herself. She's a huge believer. We are probably saving our insurance companies at least $1.2 million a year in medication costs alone, just by taking people off meds. That doesn't include ER visits, surgeries, procedures, MRIs and CAT scans. So I think if you factored all of that in, I mean, it would be in the millions annually. And I keep track of all of this because I'm always a little scared that someone's going to try to shut me down, you know, like what Professor Tim Noakes had gone through back in the day, you know. But most of my patients are able to come off of almost all of their medications. Of course, they're losing weight. We focus on inches of fat loss for sure. We focus on getting into and staying in ketosis, and just their physical symptoms from head to toe, how much better everyone feels, that in and of itself, you know?
Yeah. Oh, go ahead, Adrian. Sorry. Wrong order.
Oh, it's all good. It's all good. How are you getting the insurance to pay for this? Is this considered nutrition or because I see functional doctors and they say that they can't get insurance to pay because they'll only let you spend 5 minutes with the patient and you only get $40 a patient. So how in the heck are you still in business if you're taking insurance?
Because we are really okay. So like I said, my partner is a cardiologist, and every single patient that comes to us has some degree of metabolic dysfunction, cardiovascular dysfunction, insulin resistance, metabolic syndrome. And so that qualifies the visits through insurance just in and of itself, and so it's been wonderful because it gives me the ability to see everybody except Kaiser. Kaiser wants nothing to do with us, which says a lot about Kaiser. But anyway, yeah.
With my two children, we decided to go see a holistic doctor, and they don't take any insurance, but we are actually on Medicaid. So the fact that you take Medicaid and you're helping so many people who are struggling with diet, we're on SNAP benefits, we have Medicaid. And so it's like,
Yeah.
I feel like we're like the people who not need it the most, but we definitely need, amazing practitioners like yourself to help us. Can you share with me, like, just to make it a little more lighthearted, can you share a favorite story of a patient who found profound healing?
There's so many. Favorite. Okay. Well, I'll just highlight someone that I saw yesterday. He is a 10-year-old boy, and he got sick a year ago and had a really high fever, and just in an instant developed a very rare condition where that fever caused so much inflammation in his brain that he has seizures all the time now. And, a lot of these seizure meds work to a degree, but leave the patient so groggy and just not able to function clearly. And so we're with the help of Stanford. So we're all kind of collaborating on this child now. We've moved him to what's called a 2-to-1 ketogenic diet, where it's like 2-to-1 fat to protein to really increase his level of ketosis. If he does well on that, we're going to move him to a 3-to-1 ketogenic diet and increase his fats even further to attempt to reduce his medications. But the joy that this boy has now, that he can go to school and he can play on the playground at recess and not be a zombie all day, and the sheer relief that I see and hear from his parents at each appointment. When I have patients like this, because what I do is actually hard. And it's hard because I have to jump from disease state to disease state at every appointment, and tailor it to each individual. There is no blanket way to do keto. I need to say that for the record. I also don't believe there's a blanket way to do carnivore in my experience. And so there's a lot of tailoring that needs to take place. Just for you, Ellie, like SNAP benefits. I ask these patients, what is your budget for food every month? And then we have to figure that out with them, and that takes a lot of brain effort, right? But when you see how happy they are to just get a piece of their life back, that is very rewarding. To me, that's the currency for sure.
Okay, so Ellie zoomed in and went into the one patient, but I heard you earlier talking about your heart for the Hawaiian people, and I find that amazing. Can you talk a little bit more about the Hawaiian people and why they need wonderful health practitioners like you? And then maybe even, because I heard you on Dr. Baker's podcast talking about you also have a location, I think it was on Maui, with an oncologist. Is that accurate? And maybe kind of tell a little bit about that as well.
So the people of Hawaii, right? We are a very diverse group. It's not just Native Hawaiians and Polynesians. It's all the different types of Asians that came here to actually work in the plantations, the pineapple fields and the sugarcane fields 4 generations ago. That piece of history in and of itself is extremely important and the Hawaii doctors are not talking about this. We are one of the most heavily pesticide sprayed states in the US because of our pineapple and sugarcane industry. What that means is we have some of the highest cancer rates in the US. And because of our diet, we're heavy on rice, we're heavy on sweets, and just all kinds of, just like everyone else, right? But maybe a little bit more for some weird reason. We have one of the highest diabetes rates in the US as well. And I really struggle with how many more patients do we have to put on prescription after prescription after prescription and see really no improvement in A1Cs or numbers or symptoms before we as providers really kind of stop and ask ourselves, okay, look, clearly what I've been doing for 35 years isn't working, even though these companies are coming out with new medications all the time. What can I do differently? And, you know, I did ask a couple of my doctor friends here, well, what's the deal? Like, why do you guys keep doing the same thing? And their answer is always the same. People don't want to diet and exercise. Come on, you're living a pipe dream. People are not going to make changes. Let it go. You're spinning your wheels, and that's the mentality. Yeah. Or it's vague, right? It's like, oh, do plant-based. Well, what the heck is plant-based exactly? Like, can you define it? Can you provide a food list? Like, there's these vague recommendations, and that's why it hasn't worked in the past, you know? So we give like full-on food lists, grocery shopping lists, how to eat out, how to travel, what to buy at Costco. I come up with a whole exercise plan tailored for you. Like, we all do intermittent fasting. Like, I have a whole like 8-step program that I do with each patient. It has to be that way.
You know, I see online, like especially on Instagram, it's always like an argument saying that they are against keto and carnivore because Asians can eat rice with every meal and are healthy and skinny. What do you have to say about that to those people who make that argument?
I love this question. Thank you for asking that. In Asia, they do a lot of walking, not so in the US. In Asia, they eat much smaller portions, and their food has not been adulterated and genetically modified to the degree that everything has in the US. And so, can they get away with eating a little more rice? Yes, because of all this walking that they do every day and how their food is so much cleaner, and they're not gluttonous. We're gross in the US. We're very gluttonous if you think about it. You know, so we can't highlight an ethnic group and say, well, you guys do this in your homeland, so can't you do it here? Because it's totally different conditions. And that's a great question.
Okay, I'm gonna jump in because I know Adrian had a little. It's okay, Adrian. You can go after me. Okay, so you talked about your protocol and how it's very specific. You know, there's like 8 different things that you do. I think specifically for diabetics. Can you tell us what a few of those are, and maybe some of them that are, you know, maybe not about the food, or is it all about the food?
Well, the first thing that I do with all of my patients, not just diabetes, is I correctly wean them off of carbs and sugar. And this happens over a 2-week period. This is something that I figured out myself over many years of seeing many patients. And the way I do it is it simultaneously weans you off while simultaneously lowering your sugar addiction without causing any degree of keto flu or sugar withdrawals. Okay, and that's important because that's scary for a lot of people. I hear of a lot of people say, oh, I tried keto and I cut all my carbs and sugar, but I felt so sick that I had to eat carbs again, you know? And that's something that if you can avoid that from happening, you're going to have a much higher success rate. Then I actually, once they accomplish that, then I actually teach them exactly what I want their plate to look like. Okay. And everyone's different based on metabolic needs and exercise. So it's going to be some ratio of protein, veggie, healthy fat. I do have a lot of patients that come to me for carnivore strictly, so there's no veggie on the plate. But for everyone else, we do start with a little bit of veggie because of the color, variety, texture thing, because I'm still working through all of this brainwashing of, but I have to eat vegetables. They're healthy. Oh, but I need fiber, which you guys know, none of that is actually true. And Anthony, Dr. Chafee, is completely right. Plants are trying to kill us. Like that. That's very true, you know. So I'll maybe start them with a little bit of veg, but over time I'll try to get them to slowly cut back. We do ingredient swap outs. We do not do packaged keto snacks. You know, I'm pretty strict. I do a lot of ingredient education and even just like basic cooking stuff. Why? If you don't cook, you're not going to be healthy. And I'm shocked at the percentage of adults in America that don't know how to cook. And sometimes I have to spend an entire appointment actually teaching people how to cook. Buy these appliances or this type of pan. Like it's amazing, you know, so everyone's different. At some point we start intermittent fasting. I order labs, I follow labs, I communicate with your physician, I copy your doctor on all of our chart notes, and then we always do muscle work and resistance training at some point. You have to for insulin resistance. My saying is you can walk to Timbuktu and back and you'll still have insulin resistance. You get in the gym 20 minutes, 3 days a week, you'll get rid of it. So
with all the toxicity you were talking about, you know, the chemicals being sprayed and stuff like that, do you ever find patients that can't just be healed with diet and you guys have to do other things?
So are you talking about cancer specifically?
Well, I have chronic inflammatory response syndrome. So I went carnivore and I've even gone lion diet and it didn't cure me. Like I needed to go to the doctor. I needed hormone support. I need thyroid support. I need certain detoxing. So I'm just wondering, like, what other protocols do you do? Or is it very similar to like Dr. Boz has got the keto continuum where, you know, the different levels will help with different types of healing. And I've never tried that before.
Yeah. I like her approach for sure. Yes. Okay. So this goes back to my statement earlier, right? There's no blanket way to do keto. There is no blanket way to do carnivore because everyone is different. And we do have a subset of patients that might need to go on medications for a little while, you know, but it's at every appointment, it's this constant like tweaking the food, tweaking the dose of meds, seeing, you know, and the only way we know a lot of these times is just try it and see what happens. That's the only way we're going to know. I have a lot of women that do need to go on like plant-based progesterone creams as they're going through perimenopause. And I tell them that's not a bad thing. You're not failing. Your body is just making no progesterone. And we confirmed it in your labs, you know, but I am about, let's try to find the safest things, you know, and as a doctor of pharmacy, I luckily have that advantage. For cancer, that's different. You know, the truth is, right, all of these oncology drugs, the true efficacy rate of a lot of these chemotherapy drugs is honestly somewhere around maybe 20%. And I might be generous when I'm saying that. And so these patients have the option, absolutely, of going through chemo, radiation, surgery, like mastectomies and things like that. But the ones that see me, they are doing ketovore, carnivore simultaneously. And I'm very strict with their every source of carbs and sugar for them because they do so much better when they combine it. But they always have the option with their oncologist of deciding medication wise what they want to do. I usually stay out of that, and I have no say in that.
Wow. Like, to think that, you know, you have to do chemotherapy or you have to have surgery for cancer can be helped in conjunction with diet. You know, I don't ever really talk about this, but my dad, he had cancer for a while, and he was, and I wish he's better with chemotherapy, but there was some complications, and I had wished that he would change his diet and would listen to me, because he doesn't believe in anything that I talk about. But that's not, I'm not talking about myself. But so I appreciate that you reach out to those people, or they come to you and then you help them through that, because that the moment of having cancer and then you telling your family, it really does affect everyone to the core. So speaking of kind of like pushback, like what are the, because you only said a few doctors recommend their patients to go to you. What kind of pushback do you receive from the community? Because I'm sure there's tons, right?
Especially early on, right? So 4 or 5 years ago, when I was just starting out with my actual medical practice, okay, fatty liver. Let's go with fatty liver. Is so easy for me to reverse. I can typically completely reverse it in 3 to 6 months. It's so easy. It's a joke, in my opinion. And all the other doctors like, oh, but there's no medication for it, so we don't know what to do. And I'm just like, ugh, you know. I did have a doctor call me once and yell at me and threaten to sue me over the phone if I ever saw any of her patients ever again. And when I asked why, she said, it's because you reversed my patient's fatty liver without my permission. And now this patient does not need me anymore. And I was like, you do realize we have a shortage of physicians in Hawaii. So I think your business is going to be just fine without this one patient. But she was just beside herself, you know, and maybe, I don't know, like some people will, I'm going to swear a little bit, shit talk. Like they'll be like, well, she's a doctor of pharmacy. She's not a medical doctor. So I don't know if she can do the job. And I'm like, you should actually be thankful that I'm not an MD, because PharmDs are trained and cultivated in school to want to do so much patient education. We love patient education. We like live for it. You know, it's almost the perfect degree to become a keto doctor, in my opinion, because you have to do so much educating. And that's some of the pushback I've received, and they just don't like when they've put someone on like 4 diabetes meds and now they're on insulin, and then I come along and I'm able to get them off all of their meds, because I don't know, maybe it makes them look bad. But it's not just me. Like, this information is out there. There are so many clinical trials, if that's the validating factor, but not to mention the millions of anecdotal stories that, I mean, you guys have talked to many of these people. At this point in time, there is zero reason, in my opinion, that any MD should be pushing back on this lifestyle done correctly, medically tailored. And the last pushback I get is they look at what influencers are posting on social media and they're like, oh no, this is dangerous. And that was why the term clean keto had to become an actual thing to differentiate from what influencers were showing on their social media pages, because I don't let my patients eat a lot of bacon, and I don't want them eating pork rinds and stuff. And I have reasons for that. And so that's to answer your question.
So I think our viewer, David, was reading my mind, because I was going to say, but Dr. Jodi, what about cholesterol? And so David popped this in here. Dr. J, for 2 years, wait, wasn't he a basketball player, Dr. J? Dr. Jodi, for 2 years, my cholesterol has been well over 500, HDL in the 90 area, and trigs well under 100. I think that's a lean mass hyperresponder right there. I have not had a cold, flu, or illness. High cholesterol seems to be the reason. Do you have thoughts on that? And I would ask you to please elaborate to your general thoughts on cholesterol. Sure. I am also a lean mass hyperresponder, so I'd love to hear your thoughts.
I'm a lean mass hyperresponder too. So, okay. So in my clinic, we do cardiac testing on all of our keto patients. This is how my cardiologist partner saves her butt legally from any issues. And it's wonderful because, and this is going to answer your question, echocardiograms and treadmill stress tests on all of our patients at baseline. Then these are repeated year over year. Why? Because every single patient that comes to me refuses to be on a statin. I happen to think that's a smart idea. Okay. So I look at triglyceride to HDL ratio. Okay. Triglycerides divided by HDL. And if we can get that number less than 1, we are looking pretty good, in my opinion. But it's not just that. I also look at fasting insulin because that's going to tell me about insulin resistance. And I also follow fasting sugars, A1Cs for sure. And I also very closely follow liver and kidney health. Okay, because these are our filtering organs. And so that's important. So all of these labs combined, along with how the patient looks and feels, and their annual cardiac testing, that is going to give me a very clear picture of their cardiovascular health. And so for your follower, because those numbers are scary, right? Honestly, I would be scared. My total cholesterol is 500. I highly advise that you get an echocardiogram and you do a treadmill stress test, because a blood test doesn't tell you anything definitively. Okay, this is for cholesterol. You have to do actual cardiac testing to get any kind of definitive answer as to plaque burden in the arteries, because that's what you're worried about. How much plaque is in your arteries, and you got to jump on a treadmill for that. So Cristie, if you haven't done that, might want to do it just for fun.
Yeah, I might. I just found a doctor that's actually low carb friendly. So I fired my other traditionally trained doctor because she couldn't get over my cholesterol, and I wanted to deal with some other things. And now I have this low carb friendly doctor, and she just ordered my new labs, and it's going great. So next time I go in, so tell me again what those tests are that you're recommending.
An echocardiogram and a treadmill stress test.
Okay. And most people I've heard are talking about a CAC score. Do you do those as well? Sorry, Adrian, I stole your question.
Sometimes we do. Sometimes we do a CAC score, but here's the thing about CAC scores, okay? It does not tell you how much soft plaque is on the inside of your artery. It reads the calcified plaque in the wall of your artery, and there's nothing we can do to reverse that. Once it's there, it's there. So if you come back with a score of 1100, you are basically freaking out for the rest of your life, and I'm not exaggerating. And to me, that's going to put more stress and burden on a patient mentally and emotionally. We're going to have chronically high cortisol levels. That's not going to serve them well in any way, shape, or form. And the only thing you can do about that is maybe like a vitamin D K2 supplement to make sure that any calcium you are consuming is going to your bones and not to the walls of your artery. But I, in my experience, have seen high CAC scores do more harm than good, just because we can't change it. Once it's that score, it's that score.
Do you work with your patients too on the circadian health stuff?
Oh yeah. I mean, there's like 4 pillars to health. The diet and the physical part is just one pillar, right? To be truly healthy, someone definitely has to have total health, which embodies stress management. That's things like grounding and breathing and meditation and exercise for sure. Circadian rhythm is a huge one. We are chronically low in vitamin D in the US, and the sun is the single best source of vitamin D. After that, your food sources would be fish and eggs. So I actually have my patients try to get 15 to 20 minutes of direct sunlight every single day, no sunscreen, and at least 40% of their body exposed. That is to just absorb all the vitamin D from the sun. But what it also does additionally is it really helps with circadian rhythm, which is truly important.
You know, I want to take it back because we kind of mentioned this in the beginning that they used to work for Big Pharma as a drug rep. Can you tell us a little bit about why you went from pharmacology to that, and a little bit about, like, I would say this way of helping people is probably a lot more fulfilling. So I'd love to just know your heart with that as well.
Oh, yeah, that answer is simple. I became a single mom of 2. And when you work in retail pharmacy, you work like a dog. All you do is count pills all day. It is an absolute nightmare. I don't know how pharmacists do it. I give them so much credit. The phone rings nonstop, not exaggerating. Some of the calls is doctors yelling at you because, back in those days, you couldn't read their handwriting, which somehow became your fault. And you've got all these people approaching the counter because people are constipated. People have a cold. No one's feeling well. They don't know what over-the-counter thing to use. It is a very difficult job. You working nights, holidays, weekends. You are standing for your entire shift. And so for me, I went into Big Pharma because I could have more flexibility and ownership of my schedule, take my kids to school, pick them up, take them to their extracurriculars if they were in it, have enough energy to make dinner, that type of thing. That was the only reason why I went into Big Pharma. But I don't regret my time working for them. And here's why. In pharmacy school and medical school, you get 0 training on how to truly talk to people and how to truly be a good listener. Okay? To do pharmaceutical sales, these companies spend so much money on every single employee, teaching you all of these communication and sales skills. And it's hilarious because I have to use all of these skills with every single patient every single day. And if I didn't have that experience and those years of that type of training, I don't think I would be as good as I am today as a keto doctor, because everyone that comes to me has been gaslit by their physician, totally ignored, waited an hour to be seen for 4 minutes, where sometimes eye contact is not even made with them. Like, by the time they come to me, they're so raw and just deflated that they need a provider that looks at them and talks to them and empathizes and problem solves. You know what I mean? And so for that, I think it was a good experience.
Sorry, I was so engrossed in what you were saying. I'm like, oh, it's my turn. And then I had to go find my button. Okay. So I was talking to Dr. Jodi before the show, and she was apologizing for the way she looks. P.S. Dr. Jodi, you look beautiful. But the reason she was apologizing is she was saying it's because it's her sauna and cold plunge day. And I promise you, I wanted to get into this because I've heard of sauna and I've heard of cold plunge, but I believe you do them on the same day. So can you tell us about the benefits of each of those and then why you combine them?
Okay. So 3 days a week, I do what's called contrast therapy. Okay. And that's when you're in the sauna, and the sauna that we're currently in is like 180 to 190 degrees for 15 minutes. And then you cold plunge immediately after for as long as you can take it. And I'm up to 3 minutes right now. The benefits of each are, I'm going to kind of focus on the main thing. So sauna, of course, is a wonderful way to detox, right? And if we are living in a society today where everything is adulterated, contaminated, We're absorbing and eating environmental toxins all day long unknowingly for years and years now. It's fair to say we all have a significant amount of detoxing that we need to do. And sauna is the best thing for that, right? And so that's why I do it. The second reason I do sauna is for your cardiovascular health, specifically something called heart rate variability. Sitting in a sauna for 15 minutes like that does things for your cardiovascular health. That's like the equivalent of doing like a 30 to 45 minute cardio workout. So, that's another added benefit. Now, when you immediately follow it with a cold plunge, it's what you're doing is you're microdosing stress. Okay. And you strengthen your body by doing this. You strengthen your immune system. You strengthen your metabolic health. You strengthen your overall resilience and your caloric burning rate. But there's also this entire concept of converting white fat to brown fat. Okay. And brown fat is much more metabolically healthy. But the biggest benefit that I have found is my mental health. And I was so surprised by this because that's not why I started doing this. The way you feel after contrast therapy is amazing. You get out, you're still wet, you kind of come to room temp at your own pace, right? And you get this whoosh effect. Not exaggerating, like this whoosh. And it's a dopamine and it's a norepinephrine rush of just your blood vessels opening up again and all your happy, healing hormones just flooding your body. I'm addicted. I was already happy, like being in ketosis for 8 years, doing keto and carnivore, helping people all day long. I never thought I would be happier. This has actually made me happier. And I'm like so stoked. In the sauna, the place we go to is a 6-man barrel sauna. So there's up to 6 people in this thing at one time. I've met the most amazing people in these 15-minute sessions. One is an Air Force pilot, just got back from deployment. He does this religiously every day for his PTSD. Another is a retired Marine, 4 deployments, 4 tours of duty, been on all the medications. He has found this has been the most effective thing for his PTSD. And when you hear stories like that firsthand, it's just like, what are there? Okay, yeah, brown fat, great. Like, just the mental and emotional health I honestly feel everyone should do it. I'm actually trying to figure out a way to possibly open up another clinic location where there is a sauna and a cold plunge in my office for my patients. Because I think, I'm not kidding, it should be mandatory by law. I think everyone would be happier.
I don't know. And I was looking at the Hacker Health, which I didn't get to go to, but Cristie did. And they were doing the cold plunge there. And then they were like, Cristie, what was it? They would put like the blanket, they would sit in this like pod of some sort. Could you tell?
Yeah, it was like a portable sauna thing that they had there where, and then it was like a infrared sauna,
right.
I think. I didn't see the sauna, or I didn't want to sweat because, you're in this public place. I don't know. But I saw a lot of people doing the cold plunge and I didn't do that either. So I do enjoy a sauna, but not when I'm like also interacting with others. And then the cold plunge just scares me. I don't.
It scared me for 8 years, and I finally forced myself to start doing it. And now I'm so mad that I waited so long and that I was being such a big chicken about it.
Do you think
so? I just need to suck it up.
Yeah, probably. I would do it. Okay. We could do it together, Cristie, next year if you want.
Okay. Yeah, maybe.
Maybe.
We'll
yeah,
see.
I know what you mean. But I would assume that it kind of awakens this kind of like primal urge that we have, because like, what do we do all day? We stare at our screens, we're working, we're indoors all the time. And then I would think that the extreme hot and cold would, like you said, bring all these like happy chemicals, but I almost wonder if there is like a primal instinct that comes with it as well. What do you think about that?
Yeah, I mean, you know, this journey that we're all on, think about it, right? This is what I say to my patients. This is about stripping away all the layers of crap that's in society today and taking us way back to basics because we've gotten so far from that. And back in the day, we were exposed to these types of conditions and we were so much more resilient as human beings. And now, we're so pathetic when you compare, you know what I'm saying? Like, and that's the premise of the contrast therapy is you're microdosing stress to increase resilience. So totally primal, yes. You guys got to do it. And then you got to message me when you do it. You can be like, oh my God, I was the best. I'm going to be so happy for you. It's
I
We're
love
big
that you
baby.
said, yeah, I know. I love that you said resilience because I've been teaching for 25 years and I've literally watched the level of resilience in our kids
Yeah.
like plummet over that time frame. So maybe when I get a cold plunge at my school, see if they'll do it.
And aren't they always sick now?
Yeah, they're always sick. Yeah, one gets sick, and then their person that sits next to them is sick, and then we're coming up on the season too. Like I've already had my first kid out for a couple days. I'm like, okay, here we go, you know.
Yeah.
So yeah, that's coming.
Oh.
So you mentioned talking about really working with your patients, being in ketosis, and I find that intriguing because some carnivore experts, you know, on the web talk about it's not really that important in their opinion to be in ketosis. So can you talk a little bit more about that and why you try to, you know, strive to have your patients be in ketosis?
Okay, well, I think, you know, to clarify, do you have to check your ketone levels every day? No. I think that's a big misunderstanding, but there are disease states that are gonna greatly benefit from their patients getting into much higher levels of ketosis, and you want these people to check their ketones. Epilepsy and seizures, a lot of mental health patients we're finding will do better with higher levels of ketosis. Cancer, all my cancer patients check ketones, okay? So the benefits of ketosis are this, okay? When you are in ketosis, you have great consistent energy throughout the day, number one. Number two, you have excellent mental clarity. You are just mentally a high functioning human being. Number three, you sleep great. You sleep longer, you sleep deeper. You notice you're dreaming more. So that speaks to sleep quality. Number four, you noticeably have a lot less GI symptoms and better gut health. Number five, your skin looks amazing. And there's a lot of different manifestations of that. Less psoriasis, less eczema, no acne anymore, right? All of these things, you know, I tell people I stopped wearing makeup 5 years ago from being in ketosis all the time, you know? And number six, like being in ketosis does help you manage your cravings a lot more. And so that's why you want to be in ketosis. I had a couple colleagues say, you know, you should think about rebranding the name of your company, the Keto Prescription, because keto has such a negative connotation to it. I said, well, if it has a negative connotation, that kind of makes me want to keep the name just to prove that keto is not bad. This entire thing originated from the ketogenic diet in the 1920s. The goal is for us to be in ketosis, so I will never take keto out of my company name. And ketones in and of themselves are very anti-inflammatory. They're an excellent fuel source for the brain. And so ketones and ketosis, that should be a goal for a lot of people, in my opinion.
Absolutely. That was really powerful. Everything you've said today has been so powerful. What do you think about animal-based and how do you think that affects the body? You know, like with the Randall cycle, having a lot of fat, having a lot of sugar, or you know, yeah, some people a lot of sugar. I'm trying to get my kids to be more leaning towards carnivore, and we've gone through cycles where they've been like more animal based or meat based or just low carb or carnivore, and I'm really trying to get them more on one side. So what do you think about that, especially for children, if you don't mind, or just adults
Well,
in general?
I think that in the face of what's being added to our food these days, my saying is the M&Ms of today is not the M&Ms we ate in the 80s. That's for sure, And so going animal based, right, and feeding your kids a diet high in animal proteins, eggs for sure. Eggs are so important. I have 10 of my own chickens, real butter, things like that. That's the only way you're going to eliminate all of these toxins that they're being exposed to. So I'm assuming when you say animal based, the opposite of that is plant based. Is that what you're saying?
Animal based is usually, it's kind of coined by Dr. Paul Saladino, where he has like you eating a lot of meat, but then you also eat fruit with it as well. And then he kind of goes to the extreme of like 400 carbs a day, which is not the normal thing. I don't
Well, I've never met Paul personally.
think.
I do have one of his organ pill products for myself because I don't eat organs too often. It's easier to take it in a pill form. I don't personally agree with the direction that he's taken recently. I feel I know quite a bit about fructose as a molecule in and of itself and what fructose does to the liver and the brain specifically. So I am not a big fan of eating a lot of fruit. It will worsen your diabetes. It is no longer what I would consider to be a natural sugar. Find me a fruit in the store that hasn't been GMO'd. It doesn't exist. So if we were talking about the fruits from the 18th century, which look totally different, maybe, right? Maybe we could eat, I don't know, half a cup a day type of thing. But now, no way. I'm not okay with it. One of the handouts that I give to my diabetes and cancer patients, because we have to watch their sugar so closely, is the exact fructose and total carb content of all the different fruits. And it is mind-blowing. Mind-blowing. So it's like, okay, you're PMSing and you're having like a sweet crisis. Okay, eat a 1/3 cup of mixed berries is what I say on one of my handouts. But mixed, not just blueberries. Why? Blueberries have the most sugar out of all berries. So mix it to reduce sugar, 1/3 cup type of thing. Get your little heroin fix and then move on with your day type of thing. That's the only situation I ever find myself saying like, oh yeah, fruit, but only a little bit.
Yeah, thank you for that. I find that during certain periods of time, more fruit comes in my house. I'm like, no, get it out of here. Definitely going to keep that in mind. I'd love to shout out your socials. Could you tell everybody about your Instagram? And I'm going to share it on the screen here. I'm also going to share your website as well. So tell us about what you like to share on Instagram.
So yep, at the Keto Prescription, I don't know. I talk about all kinds of stuff. I try not to be too preachy. I love to share patient success stories, and I always get their written consent prior. I show a lot of different aspects of my personal lifestyle. Like with me, what you see is what you get. Exactly what you're seeing now, that's what you're going to get during your clinic appointments too, and I really try to put out a certain energy because that's the type of patient I want to attract. I don't like lazy and I don't like crazy. Lazy and crazy can go see someone else. You know what I mean? I like the people that like want to heal and they want to make the lifestyle changes and they're so ready for that and they're sincere. And so you'll see in my social media posts, that's kind of the vibe I try to give off.
Fantastic. Oh, go ahead, please.
No. I just, I'm not like Sean. Like Sean cracks me up. I don't know how he's able to post all day long. He must have someone doing it for him. Like I'm in clinic seeing patients all day. So like if I post 3 times a week, I consider that a pretty good week for social media. Yeah, that's my website. We talk about what do your appointments include. This is what our actual physical office looks like. I do probably 30% televisits. And just, yeah, really, I try to take the main focus off of weight loss. I try to pitch it more as, oh, it's like a beneficial side effect, but the metabolic health and everything is really the main focus of this. So yeah.
Fantastic.
That's awesome. Yeah, thank you. Those are great. I definitely follow you on Instagram. So I think I saw you there with a friend of the show, Dr. Salcedo. She was on our show.
Oh, Andrea.
Yeah, Andrea. Yeah, she was on our show. It's actually been a year, I think, since she's been on our show. It was last October, I think.
So she and I are very close. Actually, in January in Boca Raton, Andrea and I are coordinating day 1 of the Symposium for Metabolic Health. This happens every January there. And Andrea and I are putting together day 1, which is entirely focused on women's health. So some of the speakers are herself, me, Dr. Boz, like real badass women that actually do this for a living. And we're going to focus on female cancers, perimenopause, and hormone replacement therapy. My entire talk is dedicated to environmental toxins and what they do, as endocrine disruptors and what you can replace things with, things like that. Because women's health is like this giant misunderstood thing in healthcare. I've already fired 2 OBGYNs myself. And this was actually my idea based on what I need in my clinic, because how women's health conditions are being approached. You've got 3 options. We're going to put you on a bunch of hormones. We're going to cut out your organs, right? Or like something else like weird. And I'm like, yo, these are not solutions. Do you know what I'm saying? And no one's doctor is talking to them about food and environmental toxins. So whole day is dedicated to women's health.
That's fantastic. There's no way that I can come to Florida in January, but is there like a thing? Because I know a lot of these things where you can buy and you can watch online. Like, is there going to be something like that available?
Yeah, so you would search for it, under Symposium for Metabolic Health. It's in Boca Raton in January, and you can totally like buy the online package.
Oh, I'm going to definitely, that's amazing. I wish I could be there in person to see all of those wonderful women. Well, Dr. Jodi, this has just been such a great conversation. Thank you so much for coming on. You were just so fast to respond. And this has just been, I think we need to have you on at some point in the future, because I feel like we just scratched the surface with you, but this was really great. Thank you so much.
Yeah. Thank you, ladies. And good luck with your journeys too.
Thank you so much.
Thank you.
Yeah.
Ellie, do you want to count us down for a roar?
Okay, everyone. I want to get your roars. Yeah. Unfortunately, she had to step off. She wasn't feeling so great. So let's hope for good health for her very soon. Okay, I'm going to count down and we're all going to roar. I want to see it in the comments. Okay. 3, 2, 1. Roar!
Roar! Yay, Dr. Jodi roared. You made my day, Dr. Jodi. Thank you so much.
Thank you.
All right, everybody. Oh, here they come. Yes. Oh, put on your roar. Yes, Eric. Thanks to the ghost.
So
Josephine. Awesome.
That's cute, right, you guys. I love it.
Thank you. See, everyone's kind of like timid, and then they do it, and they're like, "Yay, we're part of the Lioness right now."
That's an 8. We should do this.
Yes. Roar. No, it's fantastic. So you guys tune in next week, because we're gonna have the one and only Dr. Kilth, and so we can't wait to see you then. Good night, everybody.
Good night, everyone. Bye.